If you want to be healthier, yet you just don't know what to do, all these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today, we're going to talk some more about COVID-19, you guys. So a lot of places in the United States are currently moving into lockdown mode as community spread has reached quite a few locations. So community spread more or less means that folks are getting it and they are not sure from exactly where in the community they have encountered coronavirus. So that is why they are moving from just avoidance measures to mitigation measures. So I want to go into what these mitigation strategies really mean, how to get your home ready for COVID-19, and also how to clean and disinfect your household if you have a suspected or confirmed case of COVID-19. I think that being armed with information can take a lot of the stress and anxiety and fear out of the situation, so we can prepare for things and be proactive rather than fearful and reactive, if that makes sense. I know I get a lot of solace from being prepared and having this information available to me before things happen, and hopefully that will help you guys too. First up, let's talk about what these mitigation strategies are. And we'll go ahead and give you a little bit of background. Today we're mostly referencing the CDC and the World Health Organization. So with mitigation strategies, when you have a novel virus, and I'm sure most of you at this point know from the news that a novel virus means that it is new to humanity, so no one has any antibodies naturally in their body to provide a type of immunity against it. There are no vaccines for it either to help you build those antibodies in an artificial manner without having to contract the virus yourself. So when a novel virus like coronavirus, SARS-CoV-2, has pandemic potential and it emerges into the population, then we do non-pharmaceutical interventions. So that is called community mitigation strategies, as we will be discussing them today. Those are often the most readily available interventions to slow transmission of the virus in communities. It's also a set of actions that individuals and communities can take to help slow the spread of viruses that are particularly respiratory infections. Community mitigation is very important, especially in the stages before a vaccine or a drug becomes widely available to prevent or to treat an illness. So we're going to talk about the framework for some actions that local and state health departments can recommend in their community to help people prepare for and mitigate that community transmission. Selection and implementation of those actions should be guided by the local characteristics of the disease transmission, as well as the demographics of the local population and the public health and healthcare system capacity. So these are and this is the information that the local and state health departments are going to be giving out as well. So we're just going to break it down into layman's terms today too. So what does mitigation strategies mean for you? Well, that really means that we are trying to slow the transmission of a disease, and in particular to protect the healthcare and critical infrastructure workforces to make sure that they are not overtaxed, and that individuals who are at an increased risk for severe illness, like older adults or anyone with underlying health conditions. So using mitigation strategies helps us to minimize how many people die from these transmissions of COVID-19, as well as the social and economic impacts. So individuals, communities, businesses, and healthcare organizations all take part in the community mitigation strategy. And you have to implement these strategies to prepare for, and when there's already evidence of community transmission. So that's why we have things like the Texas governor saying yesterday that he was not going to implement a lockdown and leave it up to the mayors of the city, although I think that's also partly a political move. And then the mayor of San Antonio today said that we are going into a lockdown tomorrow at midnight, or rather Tuesday at midnight, until April 9th. So that is what's going on for San Antonio, Texas right now, and they may make more mandates later on. They are just trying these mitigation strategies and stepping them up to the next level whenever necessary. So that's why we've started with recommending people work at home and avoiding these groups of 10 or more. And now we are recommending that everyone essentially shelter in place and only go out once per day if necessary to go and get exercise or to take out a pet or to go to the pharmacy or grocery store. These strategies are supposed to just help prevent the spread of the transmission and give us some time to really tackle this disease without healthcare facilities being overworked. Signals that we are having ongoing community transmission could include detection of confirmed cases of COVID-19 with no epidemiologic link to travelers or known cases. That's what we're seeing here in San Antonio is community spread. So we don't know where these folks have gotten it from because they have not contacted anyone who has been traveling or been known to have a confirmed case of COVID-19. They're not sure where they picked it up. Or there's more than 3 generations of transmission. So the implementation of the mitigation strategies is based on emphasizing individual responsibility for using recommended personal level actions, empowering businesses, schools, and community organizations to also implement these recommended actions, especially in ways that could protect at-risk persons or folks who are at an increased risk, focusing on settings that provide critical infrastructure or services to individuals at increased risk of severe illness, so making sure that we're still able to keep up with the stock of face masks, making sure that doctors and emergency workers are still being able to have access to food and everything, minimizing the disruptions to daily life to the maximum extent possible as well. So we're trying to make sure that while we're having to take what are seeming to be increasingly extreme measures, that we are disrupting daily life as little as possible. So that's why teachers are going and putting this homework online and everything. Every community is unique though. So that is another reason why the governor of Texas decided to not implement a statewide mitigation strategy that would be exactly the same for each area. There are 254 counties in Texas alone, and the population density of each of those can vary quite widely. Dallas, Houston, Austin, and San Antonio are huge, but some of the areas in East Texas or West Texas or South Texas towards the U.S.-Mexico border are more sparsely populated, and it's not going to be the same risk of community spread depending on where you are. You're not going to have as many travelers. Your demographics are different in regards to socioeconomic status and who is more likely to go on these travels to China or Iran or Italy or anywhere that the CDC is marked as a level 3 concern for travel. So that is why you're going to see a lot of different measures being implemented in different counties, maybe even neighboring counties. I know that there are some smaller counties around me, even if I live in one of the largest cities in the United States. San Antonio, Texas is one of the top 10 largest cities in the United States. And so there's a lot going on here, not even at the county level, just at the city level. So what is happening for the city might not necessarily be the same thing that goes on for your entire county, or it might. It just depends on your unique community. So it's okay if a local community has something different going on than what your personal community's mitigation strategies are. Every one of these is unique, and it's going to vary based on the level of community transmission, the characteristics of the community and the populations, and the local capacity to implement certain strategies. Part of that is, it also just means like we have a big airport here in San Antonio. So that means that we are at an increased risk of getting that into the community population than a small rural area that is very far away from an airport. There are a lot of small factors and variables that have to be included in this, and that is one reason why we should not panic just because they are using different mitigation strategies in different areas. We're going to go on a quick break, and when we come back, we're going to discuss some of these guiding principles from the CDC.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Strategies for communities with local COVID-19 transmission and what the CDC is really recommending for these. So now we're going to talk some more about some guiding principles for it. We know from our last segment that each community is unique, so mitigation strategies are going to be different based on a variety of factors in each community. There are all aspects of a community that may be impacted, including populations who are most vulnerable to severe illness and others who may be more likely to be impacted socioeconomically. So appropriate actions have to be considered in that way as well. Some mitigation strategies can be scaled up or down depending on how the local situation develops. And when you are getting these mitigation plans put in place, communities have to identify ways to ensure the safety and social well-being of groups that may be especially impacted by the mitigation strategies themselves. That could be folks who are going to be more impacted because they are not able to work at home and they are considered essential personnel and they're having to work overtime hours, but they don't have someone to watch their kids while their kids are out of school. There are a lot of factors that go into this, and they are working in some areas on obtaining essentially daycare workers for these medical personnel who are having to work around the clock. The activation of certain community emergency plans is also incredibly important for implementing these mitigation strategies. Those plans can provide additional authorities and coordination needed for interventions to be put in place. They may also be implemented at any time regardless of the level of community transmission based on guidance from local and state health officials. You can read about that online in the cdc.gov/COVID-19 website, and they have some downloads for folks if you would like to see this information firsthand. The level of those activities can vary across the settings described in the table on this page, and the levels of implementation of these settings in the table may be different for different settings. So you may be using elements from this table, it's table 2 in the document I'm referring to, and you may be doing one of them at a mild or moderate level and then at a substantial level for another setting, just to mix and match those in such a way that it meets your unique community response needs. Depending on the level of community spread in your area, local and state public health departments might need to implement some mitigation strategies for public health functions to identify cases and conduct contact tracing. When you do that, then community mitigation efforts can help facilitate public health activities like the contact tracing. Contact tracing is a monitoring process that can be broken down into 3 steps. So you contact the identification. Once someone has been confirmed to be infected with COVID-19, then their contacts are identified by asking about that person's activities and the roles of the people around them since the onset of their illness. And those contacts can be anyone who has come into contact with that infected person. Your family members, your friends, people you work with, your healthcare provider. They also should have a list of these contacts to make sure they're able to identify every listed contact and inform them of their contact status, what that means, and what actions they need to follow, and make sure they get early care if they develop symptoms. Contacts should also be provided with information about the prevention of the disease. In some cases, quarantine or isolation may be required for contacts who are higher risk, such as someone you may have shared food with, etc., or cohabitated with, either at home or in a hospital is where you may be quarantined or isolated. And then there's a follow-up. So regular follow-ups should be conducted with all the contacts to monitor them for symptoms and test for signs of infection. So if you come into contact with someone who is infected with COVID-19, then you are at a higher risk of becoming infected yourself and potentially infecting other people. So keeping a close eye on everyone else you have then come in contact with can also help people figure out whether they should isolate or if they should be quarantined and whether or not they need to get tested if they develop certain symptoms. It's really important to be able to perform that contact tracing. And so part of the mitigation strategy is to make sure we're only leaving our houses when absolutely necessary so that we can perform contact tracing. It's very important right now that we are not leaving our homes and going and chilling with our friends. It's not something that we can really totally account for. Say that I go over to a friend's house and I hang out with her and I feel like I'm safe because I never leave my house, really. So I go over there, but her husband has been going to work for the last week, and it turns out that someone that he works with has tested positive for it, and he's not sure if they have been in contact with his office or if they have passed him any types of paperwork that they may have sneezed on or anything, or if he used the same restroom that they had following them being in there blowing their nose and perhaps washing their hands, but getting some of that respiratory material that they may have sneezed into their hands or coughed into their hands onto any of the surfaces that he has touched. Now that we know that you can spread it via fomites by touching it and then touching your mouth, nose, or eyes. So you're not entirely sure at that point. And that's how community spread works. And that's only like a third person example of that, where I go to somebody's house who also never leaves their house, but their partner had to because they're considered to be essential personnel, and then someone else in their office happened to get it. even if it's a large office, there are so many different ways that we can cross paths with each other each day and lead to a transmission of this virus. So it's also important to just not go over to your friends' houses and have, the Friendsgiving version of coronavirus. That's not what we're here for right now. Remember, it's good to be able to go outside and get some exercise by yourself, but you should not be going out to get exercise and meeting up with your friends to go jogging together and stuff like that. They want you guys to only be out there in most areas, especially if you're under a lockdown like San Antonio is about to be, where you're going by yourself to go jogging, and that's like the only time you're leaving the house that day. And you're not touching other stuff. Don't be playing on the playground equipment. Don't let your kids be playing on playground equipment that is shared by other neighborhood kids. Remember from my example, it only takes 1 or 2 other people that you come in contact with for them to have obtained that from something else. Act like this is an STI, you guys. That's really what it comes down to. Act like you are not sure who else that person has been around, and you want to make sure that you are protected. But instead of condoms and other measures we might take to protect against STIs, we are going to be frequently washing our hands. We're going to be socially distancing, and we're not going to be partying in the era of social distancing. Also remember that alcohol can lower your immune system, so that's not great for you right now. I know. We named this virus the coronavirus, and I'm telling you to not drink alcohol while you're all stuck at home with it. I'm not saying don't drink any alcohol, but I am saying don't go wild. Remember, they only recommend 1 glass per day, or 1 serving per day rather, for women, and 2 for men up to age 65, at which point men should only be having 1. I have not found a recommendation in that regard for women 65 and older. All right, guys, we're going to go on another break, and when we come back, we're going to talk about ways alcohol affects your immune system.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Welcome back. Before the break, we were briefly touching on how alcohol may affect your immune system, as well as contact tracing. So now we're going to talk a little bit more about how alcohol can affect your immune system. So we've known for decades that, at least in individuals who are chronically alcoholic, there is an increased susceptibility to infections that is associated with the consumption of alcohol. And that goes for both viral and bacterial infections. In fact, most alcohol-associated increases to susceptibility and infection studies were studied on human viral infections, including hepatitis B, HIV, and pulmonary viral infections. So what they've found is that in pulmonary viral infections, so that is to say, more or less respiratory infections, it's unclear whether alcohol increases your susceptibility to getting the flu or if it adversely affects the outcome of established infections. But in animal models of lung infections. They administered alcohol in conflict to the required clinical parameters and increased lung damage. So they just gave some animals some pulmonary infections and then also gave them alcohol when you are advised to not have that if you have an infection. It's saying that even though we aren't sure if the alcohol is making you more likely to get the flu or if it's just making your flu worse, there is a correlation here between alcohol consumption and a worsening severity of the flu. And in animal models, they also found a correlation between increased lung damage in animals who had pulmonary infections and then were given alcohol. So they are seeing definitely a correlation of it worsening regardless. So we're not sure if it's something that you could avoid drinking beforehand as a preventive measure or just to not drink anything while you already have it because it could worsen the symptoms. I think in general, the common sense solution here is to just be mindful of how much you're drinking. I would certainly avoid it if you have an illness, and definitely if you have an illness with any respiratory involvement as well, because these pulmonary viral infections have been shown to be worsened by the combination of alcohol while you are sick. Bacterial pneumonia has also been found to be increased with folks who drink heavily. And while a glass of wine is far different from drinking heavily each day, the increased use of alcohol over days or weeks might suppress your immune responses, and it could lead to a greater susceptibility to pneumonia. And pneumonia has developed in individuals who have exhibited moderate to severe COVID-19. So while the mortality rates right now tend to be highest amongst the elderly, younger people are still at risk of complications as well. Nearly 40% of people hospitalized with COVID-19 in the U.S. were between the ages of 20 and 54, and more than half were in the range between 20 and 44. This echoes some similar findings in China, and as social distancing becomes more the norm at this point, then I understand that a lot of us may feel lonely or depressed, or maybe you just want to uplift your spirits. But we just need to make sure that if we are drinking right now, regardless of the reason why, just be cognizant of how much, how often, and if you chronically drink, you should pay extra attention, as should the people who have folks who struggle with substance use in their circles. You want to make sure that you're checking on your friends right now. So loneliness, depression, and isolation, those can all promote some difficulty in the lives of folks who experience those types of struggles. So we need to pay extra attention to our loved ones, especially since the unemployment rates are kind of skyrocketing right now as there are so many layoffs and lost jobs. There's just a lot of socio-cultural and emotional factors that may be going on in addition to also just the rest of the panic that is going on in the world. So we need to make sure that we're checking on these folks who we care about and that we're reaching out to folks if we need somebody, because everyone is out here to support you right now. And there are risk factors for everyone in different ways with this isolation and the lack of the schedule. Similarly, people may be reaching out for a lot more snacks. And we've discussed in the past how folks will reach for more fattening foods, so towards comfort foods when they're upset, regardless of how much they usually eat or what their diet is otherwise. So if you have friends who struggle with eating disorders, you might especially want to check on them now. Also, people who have depression and anxiety are at a higher risk when stressed. So we want to make sure that we're checking on our friends right now, you guys, and just being cognizant of how we're treating our own bodies so that we can, if we are already drinking too much, maybe taper that down a bit right now so that we can give our immune systems the best chance possible. It can be tempting to treat this as, just a cool party with your roommates if you enjoy your roommates and stuff, where you guys just get spring break indoors all week. But it's important that we are cognizant of the other types of issues that may be going on right now and how drinking that alcohol can affect our immune systems. So clinicians have also long observed an association between consuming excessive amounts of alcohol and adverse immune-related effects, especially susceptibility to pneumonia. That is from a 2015 article entitled Alcohol and the Immune System, and it was published in the Journal of Alcohol Research Current Reviews. So they say that alcohol disrupts immune pathways in complex and seemingly paradoxical ways. When I say they, I mean the authors of this research. So there have been several studies that indicate that alcohol can give you a much harder time whenever you're sick. It messes with your gastrointestinal system, and that can in turn mess with some of those healthy gut microbes that are linked to your immune response. Alcohol can impair key immune cells in your lungs and also damage those epithelial cells, so those cells that make up the lining of your lungs. Since COVID-19 is a respiratory illness, that is why this can be particularly problematic. They say that often the alcohol-provoked lung damage goes undetected until a second insult, such as a respiratory infection, leads to more severe lung diseases. Alcohol consumption does not have to be chronic to have negative health consequences. In fact, research shows that acute binge drinking also affects the immune system. So there we have it from Johns Hopkins and a direct quote from that 2015 journal article, letting us know that acute binge drinking, like what folks may be reveling in right now as we're working at home. I saw the beer aisles, you guys. Just make sure that you are keeping in mind that even doing this not regularly can also affect your immune system. It can go ahead and take you down for a little bit, and you don't want to mess with your immunity. They say that it impairs both your innate immunity and your adaptive immunity. So that may be why you find it's easier for you to catch a cold when you are binge drinking periodically or partying more frequently. Keep that in mind. Keep in mind that it's important to check on your friends right now as well, and just make smart choices to give you and your body the best chance possible. Remember, that's what the social distancing is meant to do anyway, is to prevent us from getting sick. So we should take all of the additional steps that we can. We're going to go on a quick break, and when we come back, we're going to talk about how to plan for community transmission of coronavirus within your home.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were discussing how alcohol can affect your immune system, and now we're going to talk about how to get your home ready in case someone in your home contracts coronavirus. So, right now, we're already in mitigation steps in many parts of the United States, especially the larger cities. Some of us are on lockdown right now, so that doesn't mean you can't go outside at all. It just means that you should only be going outside to do certain things that are absolutely essential and that otherwise you should not be out there. However, that is just the definition we've been given in San Antonio. Make sure you do follow the specific ordinances local to you, because remember, as we discussed earlier, they may be very different, even city to city or county to county. So, what should you do first for your home in case you are in an area of community spread already? Go ahead and talk to the people who need to be included in your plan. So your kids, other family members in the household, other relatives, and your friends. So just discuss with them what they need to do if a COVID-19 outbreak occurs in their community and any individual needs should such a thing happen. And you can find those guidelines in depth at the CDC website. If you Google CDC coronavirus, protect your family, it should pop right up for you. That you also need to plan ways to care for folks who may be at greater risk for serious complications. So what we're seeing right now is that older adults and people who have underlying chronic medical conditions, particularly diabetes or cardiovascular disorders, may be at more risk for more serious complications. Also, early data suggests that older people in general are more likely to have a serious case of the COVID-19 illness. So if anyone in your household, including yourself, are at increased risk for complications, you can contact your healthcare provider to get some more information about monitoring your health for symptoms suggestive of COVID-19 so they can catch that as early as possible with you. You can also get some recommendations from the CDC online, and they will continue to give recommendations to keep people who are at high risk healthy if a COVID-19 outbreak occurs in your community. Also, get to know your neighbors. If you are like me, you probably do not know your neighbors. You probably know the names of their pets. I know the names of all the dogs and cats in the neighborhood, but not necessarily their owners. So now would be a good time to get to know, Little Bear's owner or Balto's owner and talk with your neighbors about emergency planning should that become necessary in your area too. If you guys have the Nextdoor app or another type of app like that connects you with your neighbors in your area, or if your neighborhood has a website or other type of social media page, then go ahead and consider adding it and see if you can maintain access to your neighbors and info and any other types of resources that may be available. I know that during the bad flooding here in the Austin-San Antonio corridor area a few years back, we had a lot of folks create city pages for what was going on in the area. So I am already in several of those from over the years before where they just converted it into any type of emergency public communications. And you guys can find those on Facebook for your specific area. Even if they don't have it for your neighborhood, there might be one at a larger level, like for your town or your city or your county. So check that out and see if you can get it as local as possible to see what's going on in the area around you. You can also join it to work on recovery efforts or to see if there are people who you might be able to help at this point. We are supposed to be maintaining social distancing, but there are a few ways that we could go about still helping each other, even if it's not necessarily in person. It's also a really great way to find aid organizations that are coming to your community. After the floods, several companies like Tide brought in mobile laundry units. So people who were without water or without otherwise having their actual home structure available to them could go and get their clothes washed. And we had a lot of aid services that mobilized that way that we mostly found out about by being on the online community. So you can also find healthcare services online, support, all types of resources, and also just access to a crazy amount of information. It'll also include organizations that provide mental health and counseling services or food and other supplies. The internet is the fastest way at this point for word of mouth to spread. So even if you're not normally a social media user, I would recommend getting into some sort of group like this, or getting in touch at least with a family member who is involved in these sort of groups or is a member of these online groups, so that you have access to these organizations. See if you can get that list from them, perhaps. Also, make your emergency contact list. You want to ensure that your whole house has a list of emergency contacts for friends, family, neighbors, anyone who is a healthcare provider for you, teachers, your bosses, the local public health department in case they need to notify them of an outbreak, and any other types of community resources that may be immediately necessary should an outbreak occur. You also want to make sure you're practicing good personal health habits and plan for some home-based actions. So we've mostly already covered these, and a lot of these are very much basic information for what you should do in the event that we're having a pandemic. So avoid close contact with people who are sick. Stay home when you're sick, except to get medical care. If you do have to get medical care, call ahead. Go ahead and cover your coughs and sneezes with a tissue, or sneeze into your elbow. If you're doing it to a tissue, you need to immediately throw it away. They don't want you to hang on to that or put it down anywhere else. Clean frequently touched surfaces and objects each day. So tables, countertops, light switches, doorknobs, and cabinet handles. And use regular household detergent and water for that. If the surfaces are dirty, you need to clean it prior to disinfecting it. So you have to get the grime and stuff off first so that any other pathogens are not clinging to any grime that's on it. It needs to be totally disinfected. But in order to do that, if it's dirty, you have to actually clean it first. In order to know what to use to clean, you can specifically go to the online website for novel coronavirus COVID-19 fighting products, and that is maintained by the American Chemistry Council Center for Biocide Chemistries. It is specifically a list of different types of materials that have been tested against the coronavirus, the new one that's out right now, the novel coronavirus COVID-19, and found to be effective. So I would just read the list to you, but it's in small print, and it is 11 pages long. So if you want to go to our Twitter page, I will be posting that link, or you can Google it yourself, americanchemistry.com, novel coronavirus fighting products list.pdf, and there's just a dash between each of those words. So with this, a lot of it is definitely Clorox solution. A lot of Clorox wipes on here, both the disinfectant kind, the healthcare kind, as well as the commercial kind. So there are a bunch on here, multi-surface cleaner plus bleach. All kinds of disinfectants are on this list. Lysol brand bleach multi-purpose cleaner is on it as well. So there are ginormous lists for you to go through to see if the type that you like to use to clean is on this list. Now, I know that a lot of folks like to just clean with vinegar, and I totally respect that. Roger and I often clean a lot of our surfaces, our work surfaces, with vinegar, but I do also have a countertop bleach spray. So now is a time to maybe lean some more towards the things that are definitely on this list. You can check it yourself and see if there's some type of vinegar that is specifically listed on here. I have not been able to, of course, go through each of these because the list is so long. So I'm really doing more of a Control F thing on here to see if my particular type of cleaning products are on here. So I did Control F for vinegar and nothing popped up for that, but you are welcome to look specifically for your product name, and perhaps you'll find something different as they go through and update this. But I definitely do recommend getting some type of cleaning agent for the inside of your home that is on this list, because it has been tested to work against coronavirus. and it includes wipes as well as some liquids and dilutables. So definitely check it out. There may be something that you already have in your house that you can use without having to obtain any other products. It's also just a really good thing to go through and check these things that you may have already purchased at the store to see which ones are really going to be working on coronavirus specifically. So maybe you can sort out the types of wipes that you use for high traffic areas like the bathroom or cleaning off the remote controls. That way you can prioritize the use of your wipes if you have some that are not really falling under the category of being really able to kill coronavirus according to this ACC document. So I encourage you to check that out and to use those tips inside to prepare for potentially having someone in your home who is affected by coronavirus. Because just because one person has it in the home does not necessarily mean that everyone will get it if we follow some of these protocols. It's not guaranteed. It is more likely, but statistically, it's not guaranteed that you are necessarily going to get it if you are sharing a home with someone, provided that you follow the CDC's guidelines for keeping a separate bathroom and sleeping area for that person. All right, we're going to go on another break. When we come back, we are going to talk about some more ways to protect your home.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America's Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America's Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America's Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about different products to use for cleaning your home in the case that someone in your house is affected by coronavirus. So now we're going to continue with the protocols that should be followed. As I briefly mentioned, you should also be choosing a room in your home to be used as a separate sick household member room. So a separate bathroom and bedroom. It would be best if those bedroom and bathroom areas were connected to each other and that other folks in the household did not have to cross through them in any way, or the sick individual to cross through other parts of the house that the well people would be in order to get to the bathroom and to the bed. So that may mean shuffling around the regular bedrooms for a little bit, but that is okay. We are just looking to do that in the case that someone becomes sick or comes into contact with someone who has been confirmed to be sick and needs to be quarantined versus isolated. You need to go ahead and plan to clean those rooms as needed when someone is sick, and you can also learn how to care for someone who has COVID-19 at home by going to the CDC website. So, if your child's school or child care facility is temporarily dismissed, you'll want to know ahead of time what the school's emergency operations plan is going to be. So there have been a lot of temporary school dismissals right now, some of them just saying 2 weeks at a time and then figuring it out when they get to that point. But school may also decide to just not come back for the rest of the year if too many students or staff are absent. So folks out there right now, it's still flu season and cold season. So on top of this novel virus that we're dealing with, you may also have schools sending kids home or deciding to cancel school, even if your child is otherwise going, simply due to the fact that so many others may be out sick right now. So if your child goes to a school where you may have had community spread, but it's not the degree to which they've totally canceled schools yet, you may want to prepare for that eventuality just in case. A few things I would recommend inquiring about include what they're going to do for continuing education and any social services that the students might normally get, like student meal programs during their school dismissal. In my hometown area, a bunch of the restaurants got together and were giving out 1 free meal to school-age kids per day. And although that has nothing to do with the school itself, I did find out about that on Facebook in a hometown Facebook group all the way here in Texas when my hometown is in North Carolina. So definitely check that out. That's where some of it's going to be passing around. But also you can contact your child's school and specifically ask them about what's going to be happening and what's going to be expected of you and your children during school dismissal. And if you're able to make time to do that before it happens in your area, it's just going to save you a lot of frustration. So we are all learning how to do new things for the first time right now. But I think that in my experience, at least, I found it to be less unsettling if I knew something was coming ahead of time and I was able to prepare for it in some way so that when the event came, I'm like, okay, now I'm ready for this. It's like studying for tests versus pop quizzes, and why there's just some type of extra anxiety associated with a pop quiz, because it's like, how do you prepare for something that you don't know is coming? And in this case, we know that something is potentially occurring, so we are able to prepare for it, and I think that that makes it a little less scary. So we have a checklist provided for us online by the CDC. We can go ahead and talk to our children's schools or childcare facilities. Also, maybe talk to your boss about what may be happening, like what's going on with your sick leave policies. Is there any way that you can work remotely, even if your company has previously told you no? This is a whole new ballgame, so they may say yes at this point, and everyone who can work at home right now should be in these areas where we are moving towards mitigation. So just check that out. I know also right now a lot of webcams are already sold out. So if your job would require you to have certain specs for your webcam or to have different types of office equipment like a headset or a webcam or a physical mouse, not just a trackpad, whatever those needs may be, you might want to go ahead and check now so that as things get restocked, people can take a reasonable amount of them in waves as folks are told that they are able to work from home. You might also want to check about what internet specs would be required for you to work at home. You may also need a way to connect an Ethernet cable to your computer. Now, if you have a PC, a Windows PC, that's normally not going to be that difficult, but if you have a Mac, you're going to need a special converter piece for that depending on which MacBook that you have. So be aware of that. You are also potentially going to need to set up an area in your home where you can have these meetings and have a quiet, distraction-free work environment. Now I say that, but that is going to be totally something different when you come home and you have a dog or any type of pet in the house that tends to be louder, or you have like a really chatty cat, or you have children. Sometimes you just can't do anything about all of the noise in the background, but try to have a talk with the kids and stuff if you're able to, or talk to your roommates if you have roommates who are home and that you're having to spend the social distancing time with. Also consider letting your boss know that you're going to do everything that you can, but that you do have children. Or you can just ask for forgiveness rather than permission. That is totally up to you. I've been really fortunate to mostly have cool bosses, and I tried to also be a good boss who kept in mind that my employees were real people just doing the best they could. So sometimes there's going to be a munchkin in a performance review. It's not that big a deal. It is okay. We are all struggling and doing our best right now. So let's try to just loosen up the restrictions a little bit. If it's not impacting their work adversely, then just let it slide right now. It's not really necessary. We may need to reassess rules and policies right now that just don't make sense for this specific era of people working from home. But once you have your employer's emergency operation plan and you know what the sick leave policies are, you know what you're going to need for teleworking, and you'll know if your company is cool with you just teleworking or what the sick leave policy is right now if you come down sick and should really stay home to avoid contacting anyone at work. All right, we're going to go on a break, and when we come back, we're going to talk about what to do during a COVID-19 outbreak in your community.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. In our last segment, we were talking about ways to prepare for COVID-19 in your household plan of action. And now we're going to discuss what to do if you have a COVID-19 outbreak in your community. You want to make sure that if you have COVID-19 symptoms, first and foremost, you stay home from work, school, and any and all other activities when you have those symptoms. That may include fever, cough, and or difficulty breathing. Keep away from others who are sick. Limit close contact with others as much as possible. That is about 6 feet. So put your household plan into action. So if you already have that household plan, you can just have all that information on the fridge or on the wall and go and refer to it. Then just keep up with the up-to-date local COVID-19 activity and information from public health officials. Make sure that you are aware of the temporary school dismissals in your area or anything that might otherwise affect your household routine. Then you stay home. So if you are sick, make sure you stay home. If a member of your household is sick, you should also stay home. Remember that isolation means that you are symptomatic and have tested positive for COVID-19. And that quarantine means you have been exposed to a person who is symptomatic and positive for COVID-19, but you don't yet know if you're going to develop the virus. So they are isolated and you are quarantined. So they have to stay home because they're sick. You have to stay home because you could be sick. And they want you to be home for at least 14 days following that. If your kids are in the care of others, you may want to see if your caregivers can watch out for COVID-19 symptoms. So if they were at grandma's or babysitter's or daycare, school, anything like that, then they need to all be told so you can really put that contact tracing into effect and make sure that if someone else has gotten it from you passing it on to your kid, and then your kid passing on at school or daycare to another child, that we're able to trace that back through the community. It's very important not just to warn everyone else that they should quarantine to help prevent even further spread of it, but also so that we can trace it backwards as well and reproduce where it came from. So do your contact tracing for it. Make sure that you are notifying everyone as you go along. Stay home. Continue otherwise practicing everyday preventive actions. So we should always cover our coughs and sneezes with a tissue and wash our hands with soap and water for at least 20 seconds. If soap and water aren't available, remember you can use hand sanitizer that is 60% alcohol or higher. The person who's sick should also use the separate room and bathroom that you've set aside for sick household members, if you were able to. That's what we were talking about earlier, and perhaps shifting around rooms as well. You should certainly avoid sharing personal items like food or drinks, hairbrushes, anything like that. And provide your sick household member with clean, disposable face masks to wear at home if you have those available to help prevent spreading COVID-19 to others. They should still be staying in their area, though. That doesn't mean put on a mask and go out into the living room to chill with the family. They really need to stay in their area and also wear that face mask when they are around other people at all. It's just going to help in general when they're coughing too, to help prevent the spread of the respiratory droplets. We need to also make sure that we are cleaning the sick room and the bathroom as needed to avoid unnecessary contact with the sick person. If the surfaces are dirty, remember you have to clean the dirt up with detergent and water first, and then you can go ahead and disinfect it. Stay in touch with other people by phone or email or social media. You want to make sure that if you live alone and you get sick during the outbreak, you have access to help. So it's partly for your emotional and mental wellness, but also important for your physical health to have someone who is going to be checking on you during an outbreak and a buddy for you to check on too, especially if you have a chronic medical condition and you live alone. You should also take care of the emotional health of all your household members. It's going to be really stressful, you guys, and children react to adult stress, particularly the father stress, as we discussed in one of our latest episodes. So talk to your kids about the outbreak, and when you do it, just try to stay calm. They're getting information from all over the place, and kids vastly misunderstand things when they are communicated by older siblings and older kids in general who barely understand the concept themselves. So it's like a game of telephone, you guys. It can get pretty wild, and you want to make sure that you're talking to the kids in a really calm way. Reassure them that they're safe, let them know what they need to do to keep their hands clean, and make them aware of the household plan. That way, they're going to be more prepared and they're not going to be so stressed out and anxious if it comes down to it, because they know what the next steps are. A lot of our fear stems from the unknown, and we can prevent a lot of that just by taking this knowledge into our own hands and learning about it and making sure that our kids understand it too. So everyone in the house should be in on how to wash your hands appropriately, how to use hand sanitizer appropriately. And you can also just pick a family song that you're going to sing. Maybe everyone can sing along when someone's washing their hands as well. Do something to make it fun. Each person can pick their theme song, perhaps, for while you're washing your hands. Just do something silly and make it fun. Remember that just because something is important to do doesn't mean that you can't take joy from the process of doing it, and you can't have fun while doing it. So take a little bit of the stress out of the lives of everyone in the house by trying to make this something that is fun and engaging. It's going to help make sure that everyone washes their hands and helps folks to just not be stressed. You can let your workplace know ahead of time if you maybe need to change your regular work schedule, especially if someone in your house, aside from you or you, are sick with COVID-19 or your kid's school is dismissed. You might want to try some different hours if your work is open to that. You can also try following a couple of steps to protect your kids during the outbreak, like keeping track of those school dismissals. We already knew about that. Also, if your kids become sick with COVID-19, let their childcare facility or school know so we can prevent that from spreading to other kids. And discourage kids and teens from hanging out in public places while school is dismissed. We don't want them gathering in these areas and spreading COVID-19 at this point either. So remember, they shouldn't be out on the playgrounds or touching other things that other people touch a lot. And they shouldn't be playing together with other children who are not really in the home right now. After the outbreak has ended in your community, it's important that we still continue to act. You want to make sure that you're working on evaluating how effective your household's plan of action was. So note some important lessons learned, discuss them with each other. How did it go in preparing for home, work, and school issues, talk about any problems found in your plan, and work towards finding effective solutions. You can also look for additional resources that you and your household might need next time. Maybe you bought too much of one type of food and not enough of another, or maybe there were resources in the community that could have been helpful as well. You can also participate in community discussions about emergency planning. So go to your town council meetings. Watch the town council meetings online now, if they are still doing those in your area, but also go to them in person after all of the outbreak has ended in your community, so everyone can learn from each other. Then continue practicing everyday preventive actions. Take care of the emotional health of your household members, just like normal, and help your children cope after the outbreak. A lot of kids are going to be very stressed out from this, especially if you are also having a stress reaction. So we want to make sure we're talking to them and that we aren't just talking at them, that we are asking them questions. Remember from the emotional wellness episode for kids and parents right now that we discussed the importance of asking as well as saying. So we want to elicit these long form responses from them, things that are open questions as well, not just yes or no questions. So something like, how are you doing? That's going to hopefully prompt them to say more than good, but those types of questions where it's not just something they can say yes or no to. So parents, teachers, and other adults, we are going through this a little bit differently than the kids, and it's important for us to work together with each other as well to share information about how the kid is coping. We want to make sure that they're not just putting on a brave face at home or at school. Go ahead and let your teacher know or let the parents know or the other adults who are perhaps involved in childcare for your kids so that you can go, hey, so-and-so seems pretty happy at home and everything. How's he doing in school? And you guys can see if there's any discrepancy there that might indicate that the kid's having a little bit of trouble coping. Overall, it's just things that we should normally be doing anyway, for the most part. So just having good communication with the people who are in our lives, taking emotional care of ourselves and others, and making sure that we are staying home when we're sick and practicing preventive actions like covering our coughs and sneezes with tissues and performing proper hand washing. Lastly, make sure that if you are going to be trying to clean coronavirus from surfaces in your home, that you need to be cleaning with some of those products that are approved and have been found to actually combat coronavirus. Again, that's americanchemistry.com/novel-coronavirus-fighting-products-list.pdf, and I will be adding a link to that on our Twitter page as well. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask you to please like and subscribe, and writing a nice review always really helps us. Also, if you can please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.